Assalamu alaikum and welcome to the Dr. UUT channel. In this video, we will talk about the cardiac failure, heart failure, or congestive heart failure. This lecture is available in Urdu. Now we'll commence the lecture in English. Heart failure. What is the function of heart pumping? When this pumping mechanism becomes weak, we call it as heart failure. What are the reasons behind to weak the pumping action of the heart? Myocardial infarction, arteriosclerosis, arrhythmia, hypertension means high blood pressure, and etc. These all are actually the causes of the cardiac failure. So what happens when the pumping action decreases? The cardiac output, the physiological term is cardiac output, it actually decreases. When the cardiac output decreases, what happens? The tissue perfusion decreases. Means there will be not that much blood supplied towards the tissues. So the tissues need the blood. Now the blood supply is less due to the weak pumping action of the heart. So like this, what will happen? Where two systems in the body will activate. One is called the sympathetic nervous system, another one is called the RAS system. By these two systems, the heart will regain the normal cardiac output. What is the mechanism through which it is regaining the cardiac output? Well, the sympathetic nervous system. First of all, when the cardiac output is decreased, so the ventricles will pump the blood of low concentration. That will reach the carotid sinuses in aortic arch or aortic arc, where there are the baroreceptors. Now this blood is of low concentration and of low pressure. These pressure sensitive receptors will sense the blood, and then these receptors will send the signal to the sympathetic nervous system that the blood concentration is decreased. So you have to increase the concentration by increasing the heart job. So what will happen then? Then the sympathetic nervous system will start activating itself on the heart, on the blood vessels, mainly arterioles, and on the kidney. We have the sympathetic supply on the sinoatrial node, SAN. So increased activity on the sympathetic nervous system will increase the heart rate, and we have the supply of sympathetic nervous system on the ventricles. So the increased sympathetic activity on the ventricles will increase the contraction of the ventricles. So like this, when the heart rate is increased, the ventricular contraction is increased, a kind of output of the blood will be increased. We can say that cardiac output is somehow increased. And the second side, that is on the arterioles. The sympathetic supply will constrict the arterioles, due to which what will happen? This arteriolar constriction will increase the blood pressure. Physiologically, we will say that this will increase the afterload, the load or the pressure on the ventricles. So like this, the ventricles will receive more stress. So actually the sympathetic nervous system is giving the stressful supplies to the heart in order to increase the stress on the heart. When the stress on the heart increases, the heart will start contracting and relaxing in a strong way. So once again, we can say that cardiac output is somehow increased. And the third supply is on the kidneys. The sympathetic supply on the kidneys will increase the release of the renin. The kidney also releases the renin. So now we got two ways of releasing of the renin. One is through the sympathetic activation, another is through less perfusion to the kidney itself. So now both will combine together and will start releasing of the renin. Now this released renin, we studied in the RAS system that renin is responsible to produce the angiotensin II. And this angiotensin II has got now three jobs to increase the cardiac output. One is on the adrenal gland, that is by releasing the aldosterone. Another one is on the antidiuretic hormone, and the third one is on the arterioles. Coming to the first one, when it acts on the adrenal gland, it will release the aldosterone, and by means of aldosterone we know that its action is on the nephron. It will cause the reabsorption of the salt in water. Like this, when the salt and water comes back to the blood vessel, so the blood plus salt plus water will increase the concentration of the blood. You can say blood volume will increase, and when the blood volume increases, there will be increased supply of the blood back towards the atria, then to the ventricles. Like this, there will be a kind of increased venous return, we can say, which will also increase a kind of stress on the ventricles to stretch and to contract again back to pump the blood out. So it is also kind of acting in increasing the stress on the heart. And we have the next, that is on the antidiuretic hormone in the pituitary glands. So now this antidiuretic hormone, again we know the job of the antidiuretic hormone is on the nephron. It also reabsorbs the sodium and water, means salts and water. Now again the blood volume will increase, again the venous return will increase, again the ventricles will get the stress, and the heart is responsible to give the reply of the stress in the form of contraction. Then the ventricles will contract, like this output is again increased. And the third one we have, that is on the arterioles. Angiotensin, the name is telling itself also. Angio means blood vessel, tensin means tension. So these are actually increasing the tension on the blood vessels like arterioles. When this tension increases, it again, I told you before, it is increasing the blood pressure. Arterioles, when arterioles are constricted, they will increase the blood pressure, and the increased blood pressure will increase the afterload. Then the ventricles again will receive a kind of stress, and the ventricles are responsible to give the reply to the stress by means of the contraction. Now again the ventricles will contract to pump the blood again out. Like this the cardiac output will increase by two ways, by means of the sympathetic activation, by means of the RAS system. When time and again these systems are activating or bringing the cardiac output back to the normal, they're actually increasing the heart rate. They're actually increasing the contraction of the heart. Afterload, preload, means they are bringing the heart into stress time and again. Now this stressful situation may remodel the shape of the heart. Now this cardiac remodeling may happen, due to which then more worse condition may happen to the cardiac failure. So before the cardiac failure worsens or aggravates, we'll go for the pharmacology. Then we treat this cardiac failure with the following pharmacological drugs, which will we study in our next video.